Hello, welcome to a broker webinar. It is noon, so I think that we will get started here. If additional people log in, that's fine. My name is Frances Fiat, and I'm the Sales Manager for HealthSource RI for Employers. I welcome everyone to our broker webinar. The topic is 5 things Rhode Island brokers need to know. Just items for everyone who has logged in. If you can please put your phones on mute so that you hear any background noise. We will question and answer period at the end, but there is a line open where you can write in a question. Then if I have questions, I can review those at the end. I will also give you contact information at the end of the webinar. So I want to thank everyone for joining us. This is our 4th webinar that we have done, and we're doing these on a monthly basis. So let's start it. 5 things Rhode Island brokers need to know. We have topics we're going to review today. The first is HealthSource RI for Employers and our business engagement team, transitioning customers between the individual and family side of HealthSource RI to the employer side, state continuation, which is known as Mini-COBRA, and Group Medicare. Topic 1, HealthSource RI for Employers. We would like brokers to know that we are the exclusive source for offering employers a multi-carrier option for small employers. Employers being employers that employ between 1 to 50 employees. The carrier option is that we have medical with Blue Cross and Neighborhood, and we have dental with Blue Cross and Delta Dental, and we also have a full line of ancillary products. We are full choice model. There's no eligibility requirement with a number of participating employees. You need to have at least 1 employee on payroll who can enroll. And the full choice means that once the company does their defined contribution and picks a reference plan, the employees have the ability to pick the plan that fits to them for both their medical needs and their financial situation. So call it buying up or buying down. The contribution is so that business owners can control what's spending on their annual health care budget, and employees can have control around what plan they pick. They can control their share that's going to come out of their paycheck. We have a full business engagement team here in our Rumford, Rhode Island office that is here to assist you with new business quotes, renewal quotes, on-site support when you do open enrollment, and adds, changes, terminations. It's very important that you keep our team, both the sales representatives and the customer service representatives, in the loop so that we can verify that everything goes to billing and the enrollment system in the carriers correctly. You can contact us Monday through Friday, 8:30 to 5 p.m. at 855-688-6757. Our customer service representatives are in the queue for the customer service line during those hours. We also have sales representatives that the brokers work with, and they all have their own individual lines, and we can talk about that at the end. And our website is healthsourceri.com/employers, and you find a variety of information for the employees, and there's also a broker tab. To review, if an employer reaches out to a broker talking about having a new employee coming onto that group, it's important to ask the employee where they're coming from for insurance. Did they come from a previous job where they had it, or maybe they're on COBRA. If that employee states that they've had coverage at HealthSource RI for individuals and family, it's very important that you tell them what they need to do. Yes, we're one program for employer and individuals and family, but it's 2 separate entities. So when a customer has coverage through the individual and family side, when they join a group employer, it does not automatically cancel the insurance they have on the individual and family side. Customer enrolls with that employer and sets up their coverage for the new month. So I want to give you an example. The customer for March 1st with their new employer, and some money may be taken out of their paycheck. On the individual family side, it's important that prior to March 1st, they notify them to cancel their insurance. So they want to do it as of February 28th. If you call the individual and family side on March 2nd, the station will process as March 31st, and that individual would be responsible for that premium on the individual and family side for that month of March. So communication is very important. Individual and family side can be reached at 1-855-840-4774, Monday through Friday, 8 a.m. to 6 p.m. They are an office where they do walk-in at 401 Wampanoag Trail, East Providence. They can be reached online at HealthSourceRI.com. The item I'm going to talk about is COBRA. COBRA is the Consolidated Omnibus Budget Reconciliation Act that was enacted by the federal government for protection for employees. It is to employers who have 20 employees or more eligible employees. Companies that have less than 20 eligible employees do not qualify for COBRA, and we will talk about that next. So let's talk about COBRA. It allows terminated employees the right to continue employer health and dental benefits for themselves and their families. If you have specific details on COBRA, you can reach out to the COBRA federal database, part of the Department of Labor, at www.dol.gov. Allows that employee who's leaving to extend coverage for themselves and family for up to 18 months. In the case of a disability, it's 29 months, and in the case of a divorce, death, or Medicare eligibility, it's 36 months. So it's important when someone reaches out, the company or the employee, saying that they're terminating, you need to find out, the reason that they're terminating, but you need to know if the company is over 20 or not. So if they're over 20, they qualify. And how COBRA works is the employee stays on the census. And we are going to be looking at their composite, which is that average rate. The employer has to bill that employee for that full premium. Employers are allowed to add on a 2% administration fee. So they are the ones responsible for billing that employee, collecting the premium, and dealing with the situation of what happens when they don't get that money, because the employer has to pay HealthSRI for the coverage, which then goes to carriers. So like stated before, employees stay on the company census. The company is billed on their monthly invoice for that employee's rate, and the employer is responsible for collecting that premium. The invoice will show the word COBRA next to the employee. In any situations where you have terminating employees, it's important to keep us in the loop. We make sure that the processing is done correctly in the enrollment system as to whether they're COBRA or not, if they're Island State continuation, that it flows to billing correctly, and that everything is in sync. So to a group that has less than 20 employees. Has less than 20 employees, so a company with anywhere from 1 to 19 employees, these are eligible for Rhode Island State continuation, which is Mini-COBRA. Mini-COBRA is slightly different than COBRA. If an employee leaves voluntarily, meaning they just resign or leave their job, they do not qualify for Rhode Island State continuation. So reach out to us. It's a company less than 20. The employee has just decided to leave the job. They don't qualify. They would be just completely terminated off for the system. The extension of the employee and their family members is up to 18 months, but they cannot get Rhode Island State continuation for any more than the months that they've worked for that company. For example, someone is hired, they work for the company 6 months, and then there's a downsizing where there's a layoff. That employee and their family would only be able to do Rhode Island State continuation for 6 months. They wouldn't be able to do it for 18. If they're family members, they are completely removed from the census for that company, so they no longer are part of the composite average. They won't show on a renewal quote. They are not associated to the group. However, the employee is billed directly by HealthSource RI. So we manage that piece of it, that we bill them directly for the full list amount of their full list bill is on the particular plan that they're on for themselves and their family. And this bill is always based upon their ages and the relative value of the plan that they're on. Okay, so our last topic here is around who qualifies for Medicare. Eligibility for Medicare begins at the age of 65 and is managed by the Center for Medicare, known as CMS, which is managed through with Social Security. It mails a letter to the employee 3 months before they're going to turn 65 to their home address. The initial open enrollment for anyone who's going to transition to Medicare is from the 3 months before they turn 65, the month in which they are turning 65, as well as the 3 months following them turning 65. So it's a sort of a 6 to 7 month window of the initial enrollment where they can join and do their research. There are 3 parts to Medicare. All of us who have been working, have a working life, we are paying out of our paychecks taxes to Medicare. And when we're 65, we are eligible to move into Medicare. And we go and get our Medicare card. However, those taxes are only covering Part A. Part is hospitalization. So the money that's been paid allows everyone to have access to hospitals and the costs associated with having a hospital stay. That's Part A. And that is never going to have a premium. But the 2 other parts to Medicare. Part D would be anytime you see a provider or need diagnostic services, and Part E would be medications. 2 parts do not go kicked right in with A. They're 2 separate parts. So employees need to reach out to let the government know what they're doing about B and D. They may take the with their Medicare card and opt out of B and D initially because they're under a group plan somewhere else and they have the coverage they need. You need to let Medicare know that, because someday when you want to opt into B and D, if you have not notified them, there are late enrollment penalties. I just want to let people know that individuals under 65 with disabilities also qualify for Medicare, and I did show you a picture of what the Medicare card looks like that they get from the government. If decides to move, you can do group Medicare and there's individual Medicare. If an employee is still working for a company who's 65 or older, they can do a group Medicare supplement, but the dependents cannot move with them. Medicare is for that individual only, and so the dependents would not be able to go with them. And if the dependents, meaning the spouse and children, don't work for the employer, they can't stay on the employer plan either, because you can only be eligible if you're an employee. But it's a qualifying event, and if the company is over 20 employees, the spouse and children can qualify for COBRA to stay on that same plan for up to 36 months or 3 years. And these companies with less than 20 employees can move over to the individual and family side, where they compare different plans that may be a fit for that spouse or children, and they may find that they qualify for financial assistance. Benefits to looking and discussing Medicare with an employee on a company that's 65 or older. Employees who move to group Medicare help to lower the average age of that employer, which affects composite average. So it affects composite average as well as for the renewal quote, and it is a factor for everyone who's working for that company. The employer can pay, if the person moves to group Medicare supplement, the employer can pay the premium that for the employee. And the cost of those supplements is a much lower rate than what you're being charged for an employee in the small group market. All Medicare supplements have been built with population in mind, and they offer various options, and many of the supplements include dental and vision coverage. So it's an option for the employer and the employees to look into this. And one of the key factors I want to make clear to everyone is that employers who have less than 20 employees, Medicare is deemed primary, so they always have to have their Medicare card, which covers Part A. That's primary. Whatever else they have is secondary for their insurance. But employers who have more than 20 employees, it's the way around. Medicare is secondary, and their other insurance is primary. So think about, we have someone in our office who is certified in Medicare, and so we can assist you with any questions on this, and that's problem solving. So I'm going to open it for any questions, comments. If you have a question and you can take yourself off mute, feel free to ask it. Any questions on the chat line? Does anyone have questions? So we'll just move on to what's next. So I want to let everybody know that we do these webinars monthly on the third Thursday of every month, noon, but that time can vary. I want to know about our next webinar. April is going to be on Thursday, April 19th, 11 a.m., so from 11 a.m. to about 11:15, 11:20. Our topic is going to be HMOs, then and now. Our presenter will be Emily Colton from Neighborhood Health Plans of Rhode Island. We would love your feedback on topics that you would like going forward for these webinars, as well as any questions, other items you would like to put into us. So those items can be sent to either, we have Jocelyn, our operations analyst. So you feel free to reach out to Jocelyn here at HealthSource RI for Employers. Jocelyn's her first name is Jocilin, period. Her last name is HARDGITINI, NFPHealth.com. Her phone number is 1-857-49-2068. Again, my name is Francis Cia. I'm the sales manager for HealthSource RI for Employers. I oversee our sales team. We have reps that are matched up to each of the brokers, and most of you probably know those people, but if you're not sure, you can reach out to me. My line is 401-236-809, and my email is Francis, the name is THUOTTE@NFPHealth.com. This is our fourth webinar. All these webinars are being downloaded and stored over to the website that we have for HealthSource RI. If you go into the broker page, you can see the prior month webinars are listed there, and you can click on them at any time and watch them again, review the information that we've presented. So everyone today for joining us for this webinar. And as I said, if you can contact us with any questions or things for going forward, that would be great. Thanks, and have a good day.
Thank you.